The Honourable Health Minister's comments little disturbing. Yes, he mentioned urgency. As I continue on with my speech here, I'll talk about some clients that have contacted my office, and I have advocated on their behalf because they went through all the channels to try to get some help from the Minister's office and haven't gotten anywhere. Clinical evidence. I'll talk about clinical evidence in here. You mentioned what is covered. One of the gentlemen from my constituency that had to go to Vancouver to get 3 discs replaced in his neck. They said the discs aren't covered. They were like $3,000 a disc. They classified them as hardware. I don't know. I don't know why they would classify discs as hardware. They did pay for the anesthesiologist and a few things, but I've had numerous people come through my office looking for some help. The gentleman with the 3 discs, Russell Coyne, he suffered for years, 30% compression in his spinal cord, with loss of function and some feeling in his left arm. Said it was going to be a 2-year wait before he could get help here. An Alberta orthopedic specialist advised him that if it is not taken care of soon, he'd be teetering on full paralysis, and this needed to be addressed urgently. The Honourable Health Minister just mentioned urgency. Well, he couldn't wait 2 years to get his disc replaced in his neck. He's a young man, a young family. He had to make a living. He couldn't make a living laying on the couch, being afraid that he was going to become paralyzed. So he had to go to Vancouver and paid I think it was $27,000. He didn't have $27,000 laying around that he could throw into healthcare, but he had to get it done. Went through the whole process. You know how much he got back? $1,500 out of $27,000. That to me doesn't seem like the system is working very good. This needs to be looked at. And I think that's what this committee that the Honourable Member from Rimbey, Rocky Mountain Sundre is saying. This isn't working, what is happening now. We need something to come forward to figure out what needs to be changed. Not saying that the Health Minister has to look at each one and advocate on behalf of each one, but it's under the Health Minister's control, this arm of AHS. So if he's hearing enough complaints, maybe he needs to have a look at it and things need to be changed. Another gentleman, Jesse Kett, he's 21 years old, works on the rigs, has a bad shoulder. Surgical wait time, 2 years, they told him. Another young guy, he doesn't want to be a burden on society and have to go on EI or some government subsidies. He wants to go to work. He wants to work, but he can't. He's had to take a month off of work because his shoulder's too bad. He needs to get fixed now. I don't know his financial situation. I don't know if he can afford to go out of province and get it fixed, but that's an option he's going to have to look at if he's going to have to wait here for 2 years. He talked to the group in BC about doing it. They said, yeah, we can get you in right away, like next week. Come on, we'll get you surgery. He talked to the Alberta Healthcare Insurance Plan. He was denied coverage. Can't do it. So now he's got to either pay out of his own pocket or wait his 2 years. Another gentleman I've brought up here in the House before, Grant Ellison, needed disc replaced in his neck. Same thing. Couldn't work. Was facing the possibility of paralysis if he continued on. He paid over $20,000. You know what he got back? $2,000. Something isn't quite working right. Another gentleman contacted me, Brett Bain, needed back surgery. Told he would have to wait 18 to 24 months. He's looking at other options what to do. He can't. He told me he's taking 10 pills a day, 10 pills to try to, keep functioning. Is that the quality of life that we would like to have? Would you guys like that? Would the Honourable Minister of Health like to have that quality of life where he has to live on painkillers just so he can function because he has to wait 18 to 24 months when he can go out of province and get it right away? you know, I could go on and on with more examples, but you know, these programs need to be reviewed. Something needs to be done to help these people. You know, they're trying. They're going through the system. The system is not working. They're not getting the coverage that they need. You know, it's something that concerns all of Albertans, and you know, I urge the members of this assembly to you know, take a good look at this and think back at how many people have contacted your office, and I'm sure there are many that have been contacted with examples of how this isn't working, and you know, it's time to step up to the plate and do something about it, and you know, help all these Albertans that can't get the help that they need right now in Alberta. Thank you.
Honourable member, the